According to the American Cancer Society, this year alone, more people will die of lung cancer than breast, colon, and prostate cancer combined. But the good news is there are now more screening options available than ever before to detect lung cancer at its earliest stages when it's most treatable. So Dr. Timothy Mullet joins me now to demystify fears and raise awareness of the importance of lung cancer screening. We're happy to have you here today, Doctor. First, let's talk about who is most at risk for developing lung cancer. And is it a myth that only smokers can get lung cancer?
Well, thank you, Jordan. It's a privilege to be here, and I appreciate the opportunity to spread a message of hope about lung cancer. You're right. I think that we certainly have to understand that there are people that are at high risk for the development of lung cancer, and those people have a long tobacco exposure, often cigarettes. But it is important to realize that even non-smokers can get lung cancer. In fact, anyone with lungs can get lung cancer. And so I think that it's important to understand that while tobacco is the leading risk factor for developing lung cancer, there are others, such as radon exposure can accumulate in your home, and you should have your home tested for radon. Also, heavy metal exposure, but the combination of tobacco and some of these others are important. So we want to make sure that people understand that lung cancer is preventable if you can quit smoking. Lung cancer can be found early if we can engage you with lung cancer screening, and lung cancer can be treated better than it has before. So now is a good time to be talking about lung cancer.
Okay, good. Then who should be getting screened, and when is a good time to do that?
So I think it's important to realize that we typically think of 50 and 15, 50 years of age or more. And if you have a tobacco exposure of 15 years or more, you should be talking to your doctor about this. You may be eligible for lung cancer screening. And so I think that's a message that those are the people that are at highest risk, even if you've quit smoking. But if you have a history of smoking in the past, you should be talking to your doctor about to find out if you're eligible for lung cancer screening.
Okay, so if somebody is
I
interested,
think it's important to realize that screening saves lives, Jordan. Screening decreases your chance of dying from lung cancer. And so I think if we can find it early, we have a much better opportunity for being able to bring you through this lung cancer through surgical procedure, often with small incisions, video cameras, maybe even a surgical robot to be able to get you through this procedure easily.
Okay, so then what should patients or people be asking their doctors when talking about lung cancer screenings?
Right. I think that it's important that they ask if they're eligible for lung cancer screening, to bring it to their attention that they may be at risk. I think it's also important that they try to understand that if there are any risks involved in their history, that they want to make sure that they explore that. And they also want to find out about what to expect from lung cancer screening. So ideally, this is a low-dose CT scan, a CAT scan, no needles, no injections. Lay down, takes about 15 seconds to go through the scanner. You get results back pretty quickly, and this may be a way to be able to save lives. The other thing that's important is that lung cancer screening needs to be done every year. So you get it done and you get a great result, that's terrific. Make sure that you come back and get it again the next year, because that's where we really see lives being saved, is by finding these cancers early before it's ever been seen before.
Okay, annual screenings. I didn't realize that. So what advice, though, would you give to someone who's maybe a little bit reluctant to be screened for lung cancer?
Well, I can certainly understand the reluctance. There's a fair amount of stigma that goes over lung cancer diagnosis. We have a lot of feelings about that, and we may have some history with that in terms of being exposed to family members or friends or colleagues that have been diagnosed and perhaps have been treated in the past. So I think the important thing to remember today is that this is not your grandfather's lung cancer. We don't treat it the same way that we did 20 years ago. We have new diagnoses opportunities with lung cancer screening. We have new treatment opportunities through less invasive, easier to tolerate surgery. And we have more effective treatment, even if it's found in later stage diagnosis, where you may need additional treatment. But those treatments today can be much more targeted to your particular cancer. And we have much more effective therapies that may even be a pill that can be taken. And so while we are seeing improving lung cancer survival, it's still a high-risk disease, and the best thing we can do is find it early. And lung cancer screening as you were commenting, an annual screen is important for us to do this for those people that are at highest risk.
Okay, well, where can we go for more information on all of this?
Well, that's important. I think that it's, this is an important time for us. We really appreciate the increased awareness about lung cancer and raising the importance of lung cancer screening. So I think the American College of Surgeons has more information at www.facs.org/lung. And certainly we encourage you to talk to your doctor about this and come with information. So we appreciate the opportunity to talk with you today.
Of course, and thank you so much. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.